Welcome to the What's Happening Birmingham video podcast.
This podcast is brought to you by the Jefferson County Department of Health.
Hello, everyone. This is Jarvis S. Scott with What's Happening in Birmingham today. Got the honor and pleasure welcoming back Dr. Kre Johnson from Brownstone Healthcare. Dr. Johnson, welcome back.
Hey, Jarvis. Thanks for having me back.
Great. First of all, I want to say thank the Lord. You and your husband has recovered from COVID.
Yes.
Everything, if y'all saw the earlier video, they was one of my COVID-19 survivors that kind of shared their story and everything. Yep. So how things been going with you withstanding that and other things?
Things have been going really well. Been feeling really good. I am now okay to get my booster, so I'll be getting my booster in the next week. So I'm really excited. I know. So I'm really excited about that.
Ain't gonna start from that day, y'all. But y'all get y'all boosters. You know, we got another version of the COVID cousin out here now.
Mm-hmm. Yep, we do.
So I want to bring Dr. Kre on today. It's the end of the year, beginning of the year. She's actually gonna do. She's blessed me the opportunity to do two quick segments. I want to say, but the first segment I want to talk about is the importance of an annual checkup and exam with your doctor. Yes. So, Dr. Kre, when I bring up, so tell me, what does an annual exam consist of, first of all?
So first things first, the annual exam is usually with your family medicine or internal medicine doctor. For you ladies out there, you think of, I went to the doctor this year and I saw my OBGYN, but I want to implore you that is not enough. You need to see your OBGYN ladies. And also you need to see a family medicine, general practitioner, internal medicine doctor. So during that visit, you will talk about the year, like a year in review. We'll see how your year went. Did anything happen? What changes did you have? Did you get any new vaccines? This really isn't a problem complaint visit. You don't go in there to say, I'm going once this year and I'm gonna tell the doctor everything that's wrong. We're just gonna kind of update the doctor on what's going on. And also during that time, we'll get blood work. We'll do an exam. So you should be touched during your physical exam. And from there, we'll start to say, what kind of preventative test do you need? So if you're 45 and older, you need a colonoscopy or some kind of colon cancer screening. If you're over 35, ladies, if you're 35, African-American women need a baseline mammogram, about 35, 36, and then once a year at 40. And then if you're older men, you at 40, African-American men, you need your prostate check. You need your prostate exam. You need your prostate labs drawn. So based off of your age, Jarvis, then will we start to say, who do you need to go from here? And if they make that referral, guys, please go. A lot of people have been putting their preventative exams off because of COVID. Mm-hmm. But I want to let you know that COVID is here and it's going to be here a while. So make your appointments really early. Go the first thing in the morning or the first thing after lunch so that you can get it done while you for sure the space is clean, while no one's been in that room, so that you don't have the excuse that you missed for years because of COVID, because cancer is still coming, even if COVID is here.
And two, and I want to kind of step off into this because even though we are meeting virtually, I say over the past year, a lot of people was doing telehealth when they was kind of zooming in and talking to the doctor. And explain these people that does not constitute an annual visit.
For some insurances, Jarvis, it may. If you have Medicare allows your annual visit to be virtual. However, you have to have video and audio capabilities. So Medicare, for those of you who don't know, is usually for people that are 65 and older. So they're an older population. So if grandmama doesn't know how to use Zoom or grandma doesn't know how to do FaceTime, and she can only do the phone does not constitute for a physical exam, your physical well visit. But Medicare will allow, since we're in the COVID days, for you to be able, the doctor needs to see you. So we can look at you and say, hey, Miss Smith, put the camera down. Let me see your feet. Are your feet swollen? Let me see this. So a lot of things I can pick up. I can look at you, Jarvis, and see several different things. If something's wrong, I can say, your thyroid looks a little large, even from me looking virtually. Your eyes look like they need to be checked. So as a physician, I have a trained eye that even if I'm not in the same room with you, I'm always examining people when I'm out and about. So yes, yeah, you can do it, but you need the video capabilities of it.
Okay, and like the importance of, you know, a lot of this, like you mentioned, with your primary care doctor, kind of importance. Can you just talk a bit more about the importance of having that, especially as you get older?
Yes. I think it's very important for everyone to have a primary care physician. I like to think of myself as an extension of the family. The patients, I know about their kids, their grandkids, their whatever's going on with their lives, the highs and the lows. Your primary care doctor goes along with you. Oftentimes we think that, oh, well, maybe I need to see the diabetic doctor because I have diabetes. But a lot of things that the specialists do, you need a primary care doctor to pick those things up. The primary care doctor can see you once every 3 months. You may only see your stomach doctor once a year. You may only see this specialist once every so many months, but we are to fill in those gaps for the specialist. And we're also there to pick up on new things. So you come in for your every 3-month visit, you can say, hey, this doesn't look right. Well, I don't see my heart doctor until February. Well, I can say then, well, this doesn't need to wait to February. This is more concerning. So the relationship with your primary care doctor is probably better than any of the specialists you will have, because the primary care doctor knows you probably the best because you've seen them routinely over the years.
Yeah, and I'm not, another thing too, I guess I'm gonna be very delicate how I word this. When you go to just standalone clinics, you know, they just come, they're just treating the, what they call it, the issue at hand. So you come in, got COVID. They're not one of those people that's supposed to be doing an annual checkup on you right then and there when all that's going on.
You need someone that's gonna know you, that learns you. And I can say, well, man, I've been caring for Jarvis for so long. If you come in there and you have a different look or you look sadder, I can pull some things out of you because I know you and I know you're normal. FYI, Jarvis is not my patient. I was just using that as an example. You know, just so we have to be mindful that you want a doctor for the relationship. So I say that it's important for people to have doctors that look like them, doctors that understand them, doctors that know that certain medicines work better for you based on race, based on ethnicity, based on the culture, you know, kind of thing. So I say when you're looking for a primary care doctor, look for, people call me from the black belt. They say, oh my goodness, I see you from the black belt. And that draws people. So, oh, your dad's a pastor. Oh, my daddy was a pastor. So, you know, look at the doctor's bios when you're looking to find a new primary care doctor and find some similarities. And when you get those similarities, because you got to listen, you got to tell two people the truth in your life, right? Your doctor and your lawyer, you got to always be honest with them. So you need to find someone that you can relate to, that who can relate to you, who's going to love on you, who's going to understand you, and who's not going to judge you. So in that case, do the work, ask for word of mouth recommendations, but also look online, look at the reviews, read their bios, and make your decision from there.
And then also trust your doctor when it comes to, you know, the certain referral situations, like you mentioned about men. When there's a certain age, we need to go get prostate, or we need to go get, what's the other one, the colon, you know, you know, within your network that you refer us to. Because at certain times, I guess with that, you really need to see a physical specialist because your job is not to detect, oh, I see something going wrong in your colon. That's, you know,
Exactly. So a flip end of that, of other opposite side of that, Jarvis, that I get a lot is, well, I don't want to see the specialist. I just want to see you. And I'm like, yeah, but I can't do that. I can't do a colonoscopy. I'm not trained to do that. I'm not trained to look and see what is physically going on with your blood because your blood count is low. So if your primary care doctor, no matter how much you love them, if they make the recommendation for you to see a specialist, take them up on that, because we won't be just referring willy-nilly. We'll refer when we feel like there's a need for a little bit further of a workup, or someone to go a little bit deeper than I can, because with primary care, I do a surveillance. I'm watching. Every time you come, I'm checking your kidneys. I'm checking your liver. I'm checking your blood sugar. I'm checking your iron. I may be checking your cholesterol. I'm doing a surveillance of all of these things. But if your liver starts to creep up a good bit, I may say, hey, let's go get an ultrasound. But you need to see the stomach doctor. You need to see the liver doctor. After we get to a certain point, we may recommend a referral, and that's okay. That doesn't mean your doctor's putting you down. And a lot of people don't want to go, Jarvis, because there's a higher copayment for your specialist visits. But however, you may be delaying a diagnosis, delaying treatment, because you don't want to pay the $50 copayment, and you rather go see the doctor that's your friend, that you love, that that's your primary care doctor.
So have you seen some people transition to maybe doing twice a year, every 6 months, possibly?
I've seen, I have people that come. I do an annual visit every year, and if you have high blood pressure, you have diabetes, you need to be seeing your doctor every 3 months, unless you're super controlled. If you're super controlled, then you can go twice a year. But most of the time, those levels can go up and down. So I see my people mostly every 3 months, 3 to 4 months. And then I have some I see every 6 months. There are very few people. They have to be really, really controlled for me to only see them once a year. But I start the first of the year off and I say, hey, let's go ahead on and do your physical. And we do that whether the person has made that their visit or not. I go ahead on and recommend that we do the physical at the beginning of the year. And all the time they're like, well, I hadn't had my physical. Yes, you do, because I'm going to touch you every time you come. I'm doing blood work every time you come. I'm asking about those screenings just about every time they come in. Hey, don't forget to get this done. So have a doctor that's always thinking of you, that's mindful and that's thorough, so that you don't miss out.
I'll be remiss not to ask you this or kind of get you to advocate for this. I'm going to say advocate.
Okay.
The importance of people getting their flu shot this year.
Yes. So all around, we've seen that the flu numbers are rising. And that's because last year I've gotten all these questions about, well, in 2020, we didn't hardly see the flu. Was the flu gone? Well, we were required to wear masks. So you didn't see a lot of colds. You didn't see a lot of flu. You didn't see a lot of respiratory illnesses to the extent that we are now, because we were required to be in our mask. We were social distancing. Now all of that is to the wind. So we are seeing, especially at colleges, we're seeing the flu on the rise. In the general population, the flu is on the rise because people are not getting their vaccine. Please get your flu shot. I got mine and I target mine the 1st of October every single year. And that keeps your chances of getting very sick from the flu down. You still can get the flu if you get the flu shot, but the flu vaccine keeps you from getting very, very sick from the flu. I have seen people die from the flu in my lifetime. I'm 40 years old. You wouldn't even think that that's a thing, but yes, people do still die from the flu. So I think that it's very important, especially with the world being the way it is, that you go and say, I'm going to get my flu shot. Take your little Tylenol when you get it and be fine.
Okay. So tell them where you're located and how they reach you, and if they want to have you as their primary care doctor for annual visits.
Yes, I am Dr. Kre Johnson. I'm a board certified family medicine physician. I have 2 locations. My Brownstone Healthcare direct primary care practice is in Trustful off of Camp Coleman Road. And we see everything from babies to mamas and everything in between. And I also have a location, 1700 Fifth Avenue North, Brownstone Be Well, where we see the City of Birmingham employees. So if you're on the city's insurance and you're an employee, a spouse, or a dependent, you can come see Dr. Kre at no charge. So give us a call at 205-202-5650. Thank you.
All right. Well, thank you, Dr. Kre, for this first segment. I told y'all we're doing the first segment. This second segment, we're about to dive in, and I got plenty of time left because, boy, you're not going to miss this one. So thank you all for watching this video. Please check out what'shappenedbirmingham.com for more videos. Don't forget to subscribe to the YouTube channel. And I'm on Apple Podcasts, you all, so you can listen on there. Thanks again, and bye-bye, everyone.
Thank you for watching the What's Happening Birmingham video podcast. Please check out our website, app, or subscribe to our YouTube channel for the latest videos today.